Hello and welcome back to The Path, the podcast from Lifestyle RX. Joined by Dr. Byrne as always. Good to see you again.
Great to see you, Dan.
So this episode is kind of we're trying to answer a question that we get asked a lot, which is what's our views on supplements and what supplements should people be taking for type 2 diabetes? And so we got so many of those questions, we decided to do a whole episode just talking about supplements. So I guess to start right off, what is your view on supplements overall before we get started?
Yeah, so when I think of supplements, they supplement, right? They're not meant to be a cure. They're meant to supplement whatever else you're doing. And so, if you think about the 80-20 principle, they're definitely in the last 20%. Most of what you should be doing is what we talk about in the course, and it's the lifestyle measures. And wherever possible, you should be getting, some of these supplements you actually should be getting from food wherever possible. So that being said, supplements are a little bit like medications. There's something extra that you take that it's potentially a tool, something you can use. And so, so I think it'll be helpful to go through and talk about a few supplements that we commonly come across and some of which we recommend.
Okay, great. So what we'll do is we've picked 6 supplements that we wanted to specifically talk about. So we'll go through each of them one at a time. I'll introduce it a bit, and then you can go through all the details about it. So the first one we're going to start with is Berberine.
Okay, so berberine is a natural compound coming from plants. In fact, comes from barberries, and it's been used as a traditional compound in India and China for probably 2,500 years. And for what we now know was type 2 diabetes. So there's this kind of long history of it that way. It's never been created as a pharmaceutical product, but it has actually been studied pretty well. And the studies show that it does reduce insulin resistance. It also reduces inflammation, it improves cholesterol. And so there's some other factors that are kind of useful for it. Interestingly, it works similarly to the way the metformin works. It activates an enzyme called AMPK, which is kind of one of the master regulators within a cell in terms of, whether, kind of what the cell's going to do in terms of using glucose versus using fat for fuel. So it's actually, it actually has a lot of mechanisms that parallel metformin. I sometimes joke that, if so metformin comes from French lily, right? So if if barberries grew in France, then berberine would likely be the pharmaceutical, and metformin would be the supplement. So I think it's kind of berberine is at that level. So the supplement form that you take is a pill, and most people take 500 milligram pills, and they'll take it 1, 2, or 3 times a day. Generally pretty well tolerated, but the side effects again are similar to metformin. So in that you get some GI side effects, so some constipation or some diarrhea or kind of just an upset stomach. It can interact with other medications, and so one of the things that we kind of look at with all of these supplements is talk to your pharmacist, talk to your doctor, talk to your Lifestyle RX doctor about these things to see if you're going to add them, if it makes sense. And then pay attention if you do add them, pay attention to kind of how you feel with it. And the neat thing with berberine is when you look at in China, they've done head-to-head studies with it compared to metformin. And it actually, from a blood sugar control, it actually is pretty equivalent. I always kind of temper that a little bit though, because it's a supplement, we don't always know that you're getting, are you getting exactly 500 milligrams? Is it just as pure as the last kind of batch of berberine you got? Whereas, pharmaceutical products, one of the things that they do is they're very consistent in terms of the, 500 milligrams of metformin is 500 milligrams of metformin. So I don't think it's a substitute for metformin. I think you're kind of doing the same thing with it. But even though it works in a similar mechanism, it is a different mechanism. And so there are studies that show that you can actually use both of those.
Hmm.
So again, I think it's something that, there's probably more research that needs to be done. And I'll say this, and this applies for all the supplements. The unfortunate problem is because there's no patent for a company to make money on. Nobody does this research, and so it's usually pretty spotty in terms of kind of the amount of evidence that you get for them. But overall, I say there's actually really good evidence for berberine, and it's something that that can be useful.
Cool. Okay. All right, moving on to the next one then, and I'm going to apologize in advance if I don't pronounce any of these words right, because medical words are difficult sometimes. So the next one is alpha lipoic acid.
Yeah, alpha lipoic acid is So this one's interesting. It's a naturally occurring compound, and it is also something that our own bodies make. So it's if you took did a blood test, you could find alpha lipoic acid in our blood. It works as an antioxidant, and so this is really helpful. When we use essentially when we use food as fuel, what we're doing is we're combining that that glucose or that fatty acid, we're combining with oxygen and essentially kind of burning it. Whenever you oxidize anything, there are these reactive oxidant species, ROS, that get kicked off, and those things are super damaging. So your body has all these defenses. Think about the fire. It's like little sparks kind of flying around, and you've got some defenses there for that. So alpha lipoic acid is a direct antioxidant, so it's kind of useful that way. Antioxidants, though, are a bit of a complex cast of characters. There's a lot of evidence around that people that eat diets that are high in antioxidants have lower rates of inflammation and lower rates of cancer and lower rates of heart disease, all the things you'd expect if you were able to dampen down oxidation. Yet when we've done clinical trials on supplements, like beta carotene or vitamin E, which are kind of potent antioxidants, the people haven't got better, and in some cases there's actually been higher rates of cancer in the people taking the supplements.
Interesting.
So it actually, what you realize with kind of antioxidants is it's a bit more complex than saying that if we dampen down all of these reactive oxidant species, saying that that's good. There's a balance in these. What we think now is that they're a certain amount of oxidation signal is really important to trigger other defense mechanisms. And so if you actually use an external antioxidant that dampens down, you may be dampening down a signal that is the alert for your body's defense system. And so you may be you may be short-circuiting your defense. So that's kind of one of the things that we look at when we think about taking it from an antioxidant perspective. There's some evidence that alpha lipoic acid can decrease insulin resistance and improve glucose control. It's not really that well studied. I'm not sure how profound it is. And one of the things that I think is problematic with alpha lipoic acid is, when we create it in our bodies, it's actually bound to a protein. When we take it as supplement form, it's not bound to a protein. And so it's not clear that the unbound alpha lipoic acid is going to do anything. So from a glucose perspective, it's not that exciting for me in terms of a supplement. The one thing that area that is actually kind of interesting is diabetic peripheral neuropathy, and there's some pretty good studies that that alpha lipoic acid seems to improve peripheral neuropathy. So that numbness, tingling, or pain that sometimes people will get because their nerves are being damaged by glucose, alpha lipoic acid seems to help with that. And there's studies are done in Germany where it's actually used as treatment for that. So for patients that have diabetic neuropathy, I'll often recommend that they give it a try. And it's the kind of thing that probably take it for 2 or 3 months, see if it makes a difference. And it's a pretty safe, it's pretty safe to do it that way. If it doesn't make a difference, then I think probably just stop it.
Interesting. It's always interesting to see how something that's already in the body can still be completely different when you take it like as a supplement. It's amazing how complicated everything actually is when you really get into it.
Well, yeah, there's a poster, and I've got to find a version of it that I can post in the community, but it's all the metabolic processes that occur in the body, and it's incredibly complicated. And so our body could be thought of as a complex adaptive system. Changing one thing usually will be, it'll lead to other changes, right?
Yeah.
So you do have to be careful and you predominantly what we believe in lifestyle medicine is that the best inputs to changing your body are the behavioral inputs, the things that your body's used to, right? So, actual food versus just taking a specific compound.
Yeah, for sure. Okay, so moving on to the next one, we have chromium.
Yeah, so this is one that a lot of people will encounter, and it's probably one of the most common questions I get. What about chromium? So chromium is a trace metal, and if you, I'm not even sure I remember the chemistry of this, but the chromium that circulates is trivalent chromium, and it's supposed to help potentiate or basically help increase insulin function. And so it makes insulin work a little bit better and should make insulin a little bit more insulin sensitive. So the question is, does this do anything, right? Like if you take, so again, not a lot of studies. And there really are very few studies that are controlled that that give us any results that we'd say, hey, this is going to do something. And so you kind of look at this and you go, okay, this is something that is in our food. It's not even clear that there's that it's essential, right? They haven't really been able to kind of find a deficiency of chromium. But that being said, you look at the food that it's in, and it's fruit, vegetables, meat, fish, grains. You're going to cover it. So the whole grain products are helpful. Now, of course, the whole grain products are some of them you have to be careful because they're actually refined carbohydrates. We don't want those. Others are going to be, other whole grains, maybe in that yellow light category of carbohydrate where they're whole foods, but they have a lot of carbs. But then some are clearly green light. So, green beans, broccoli, nuts, you can get chromium. Egg yolks have chromium. And then if you want I know last time I said there was no superfood, but I guess the superfood for chromium would be broccoli. It seems to be particularly high.
Interesting.
The other thing, just with this is there's probably no downside to taking the chromium. So I don't think there's any negative to it other than you're going to spend money on something that may not have much effect. So I would recommend, buy an extra vegetable instead of buying your chromium weekly.
Weekly broccoli instead of chromium. Okay. And the next one then is cinnamon, which I did not know you could use as a supplement.
Yeah. So this one is usually I'll hear it from the same breath as the chromium, and so for whatever reason, those two seem to really capture the imagination. So obviously cinnamon's a spice, and it's been used for medicinal purpose for thousands of years. And it's interesting with that. So sometimes you can kind of laugh and say, okay, because something's been used for thousands of years, should you pay any attention to that? Because they had no clue what was going on in the human body, and we really haven't, until the 20th century, really known much about physiology. But one of the things that you look at is many of if we look at many of the pharmaceuticals that we have that work, actually, you can go back like the metformin metformin from French Lily was used in Europe for about 1200 years for type 2 diabetes. So some of these things actually, the fact that they were used, there's a signal there. Of course, you got to figure out that signal, and that's why we do research. So we shouldn't just dismiss it. Two types of cinnamon: Ceylon cinnamon, kind of true cinnamon, and cassia cinnamon, which is kind of the most common variety today. And generally, what we get when we get cinnamon is this cassia cinnamon. And so what is supposed to happen with cinnamon is it actually works at the cellular level to help the cells take in more glucose, a little bit like insulin.
Wow.
And so there's some studies that show that you can take cinnamon and you can actually lower your blood, basically lower your blood glucose levels, because you get this kind of insulin-like effect at the cell. Other things show kind of that cinnamon improves inflammation and improves lipids. So again, cholesterol. So that might be useful. You can take it as a supplement form, or you can take it kind of as food. The challenge of taking it as food is it's going to be so much cinnamon that you're probably not going to like it. So the little sprinkle that you might put on your coffee, or is probably not enough, right? You're going to have to take a lot of it. And this is where it starts getting complicated, right? Because if we look at the two types of cinnamon, the cassia cinnamon, or the more common one, actually has something called coumarin in it. It comes with it that can damage the liver. So if you're taking these high doses, you may kind of get into a place where you're actually damaging your liver by taking it. So that definitely makes it more complicated. And so you're kind of left with this, recommendation. You can take 0.5 to 1 gram of cassia daily, so that that's limiting that amount of cinnamon. Or you can take up to 6 grams of the Ceylon cinnamon, is probably safe. My bottom line with this one is like, I just don't think it's worth any of the risk, right? So, when we look at taking any medication or any supplement, we got to look at what's the benefit versus the risk.
Yeah.
And here, the benefit is probably pretty marginal. And if you get liver damage because you took too much cinnamon, that'd be a pretty bad outcome. So I don't think when you weigh those two things, it's worth taking the cinnamon. And then you can look at the kind of the cost and other things. I think, again, let's do an extra round of produce.
Yeah. Perfect. Okay. And the next one here, this is a very common one, is vitamin D.
Yeah. So vitamin D, is something that, as Canadians, we should pay attention to it, right? So most vitamin D we actually synthesize in our bodies with sunlight. The problem is, in Canada, from October to April, the sun is too low in the horizon, and the atmosphere basically filters out the UV, the actual UV wavelengths that help us synthesize vitamin D. So by and large, we have to supplement now. If you look at kind of foods that you can get it, so you're going to, there are foods that are high in vitamin D, and there are foods that are supplemented with vitamin D. So our dairy products are often kind of the vitamin D's been boosted in it. We can look at kind of some of the seafood as ways to get vitamin D, but by and large, you're pretty much going to need to supplement. Vitamin D is really interesting. It's low levels of vitamin D are implicated in over 100 different diseases.
Wow.
But it's yet to be proven in any disease that increasing somebody from kind of a low level of vitamin D to a high level of vitamin D reverses the disease. So some people have said, vitamin D is a little bit of a marker for chronic disease, and that you see when it's low. I'm not sure about that. And I think that it's probably just we're looking at it maybe a little bit simplistically, because vitamin D, it actually it helps with gene regulation, and so it's the way it's going to work is going to be complicated, and I don't think vitamin D on its own can stand alone, right? I think vitamin D in conjunction with all the right things to do makes a difference. So I look at it, from the perspective that we probably, I think we need to get adequate vitamin D year round. We can get that with some sun exposure. We have to watch that we don't get sunburnt and the risk of skin cancer. But it's about 20 minutes of sunlight in kind of midday, kind of on arms, and potentially legs will get you enough. So it's not a huge amount of sun that you would be really worried about burning. So some sun exposure is going to be good. We get a little bit in our diet, and then I think we've got to supplement. So I generally recommend that people do supplement, and you can measure your vitamin D levels. You have to pay out of pocket to do that. I found that that's not that helpful, because if you're not taking vitamin D and you measure them in the winter, I'm almost guaranteed that your levels will be low.
Yeah.
And I've found that, if we just use a dose of 2,000 international units, that gets 99% of the people to a normal level of vitamin D. If you have some gut issues where you don't absorb vitamin D, so if you've got inflammatory bowel disease, maybe your dose needs to be higher. And for those people, actually checking vitamin D levels probably is clinically indicated, so you probably can get it covered. And then, I think that, with vitamin D, it's something that we probably all should supplement. So it probably needs to be part of, I think, everybody. So regardless of whether you've got type 2 diabetes or not, it's probably a useful thing to do. And so you can't really think of it as taking the place of your other medications or your lifestyle changes. It's just, I think, part of a healthy diet is just to supplement with vitamin D, at least during those winter months. Personally, I tend to supplement all year round with it, because I mix it with the next supplement we're going to talk about.
All right. And then nice segue into omega-3s.
Yeah. So omega-3s are, omega-3 fatty acids. So they're polyunsaturated fatty acids, which means that there's some double bonds in the carbon chain. And they've definitely been shown to have, potent anti-inflammatory effects. Having kind of an adequate level of omega-3s seems to be important for insulin to work on the insulin receptor. And it probably has something to do with the flexibility of the membrane. And so this is going to get a little complicated, but the insulin receptor sits in this fatty membrane, and the positioning of that will depend a little bit on how well the membrane kind of moves around. And so there's a balance of fats that we have in our membranes. Some are omega-3s, some are omega-6s, and they play an important role around inflammation, but they also play this role around just kind of how rigid the membrane is or not. And one of the things we see with people who eat high levels of saturated fat, one of the ways that saturated fat actually is harmful is the saturated fat is much more rigid, because back to those double bonds. Those double bonds make the fat a little bit more flexible, versus the saturated fat where there's no double bonds. It's a little bit more rigid. If you're somebody who eats a lot of saturated fat and you don't get a lot of omega-3s, you're going to get a membrane that's a little bit more rigid, and the insulin receptor might not sit properly there, and it might be harder for insulin to interact with that membrane receptor. So, for our purposes, there's this kind of direct linkage that, we would, we would like to be sure we have that optimally controlled. And then there's this other aspect around inflammation. And so inflammation is the body's immune system. And what we want with inflammation is we want it as a defense for when we get injured or get an infection. And then we want a very good response, and then we want to be able to turn off that response. So there's a very complex cascade of things that need to happen. And we're dependent on both omega-6s and omega-3s for that. And the omega-6s predominantly are involved in turning on the inflammation, and the omega-3s are predominantly involved in turning off the inflammation. Omega-6s are essential fatty acids, meaning that you have to eat them to get them. Omega-3s are essential fatty acids, meaning you have to get them, right? So you can't, your body's not going to make them on their own. traditionally, if we look at a hunter-gatherer lifestyle, kind of what we evolved into, that lifestyle, we probably ate 1-to-1 omega-6, omega-3, right? So it's pretty balanced. If we look at the ultra processed, kind of what people call the SAD diet, or standard American diet with kind of ultra processed foods, you're going to get 25-to-1. So you're going to get 25 times more omega-6s than omega-3s, just because of the types of oils that are used. And so, in our society now, you kind of have to think about the omega-3s to get enough of them. Just you're going to get enough omega-6s. So, getting kind of a ratio of 4-to-1 is probably a good way to go. You can do it through diet for sure, right? So, fatty fish like salmon, mackerel, sardines are, you definitely kind of can eat enough, but you're probably going to be eating for most people, it's probably more fish than they're used to.
Yeah.
We don't really know what dose is optimal to kind of get that membrane function working. And usually kind of what I'll do is recommend that people take, 3 to 4 grams of the long chain omega-3s. So when you look at your omega-3 package, it'll say there's EPA in it, there's DHA in it. Those are the 2 long chains. So those are the ones that are interesting. And, you kind of add up how much is there, and you're trying to get to 3 grams. And so by and large, I tend to use a product called NutriC that has vitamin D with it. So there's my vitamin D. And I'll use a tablespoon of that, mix it in with my yogurt in the morning. I find that really easy to do. Full disclosure, my wife can't stand that. she doesn't. She just tastes it as fish oil, so she has much more difficulty with it. I seem to be able to tolerate it. So your ability will vary there. I like NutriC because it's a Canadian product from Atlantic Canada, and it's high quality oil. It's fresh, and so that's always important when you're looking at this stuff. So I generally recommend that people actually do supplement with this. Interestingly, you can get a blood test, and you can measure the omega-3s in the membrane. You can actually, they'll take the red blood cells and they'll break them apart, and they'll give you what your ratio is in your actual cells.
Wow.
That's probably it's actually probably a really great test to do. It's not covered by medical, and it costs about $300. So it's not. Yeah. I don't think everyone's going to do it, but if you're somebody that really likes to optimize, then it's worth doing. I usually recommend people do that after they've been supplementing for a while, and just kind of see where they land. Couple of things though that, omega-3s can interact with medication. So again, talk to your pharmacist, talk to your physician. And then the other thing that we kind of look at is people who are on blood thinners. Omega-3s can make you a little bit, it can slow down your blood coagulation just a little bit. So if you're on a blood thinner, that's a very important thing to talk to your pharmacist or physician. Is it safe to take it? And then the final kind of thing with the omega-3s, because it's fat and you're ingesting kind of fat all at once, you may find that it kind of upsets your stomach. And kind of the most common thing is people, if they overdo it, they get some diarrhea with it. And that's no fun.
Yeah, for sure. Okay, so that's our list of all the supplements we wanted to go over today. So we went over all 6 of them there. So hopefully that was a lot of information for you, and you kind of have a better idea about what you should be taking, what you shouldn't be taking. Any overall thoughts on supplements in general, or anything else you want to close out with?
Yeah. I think just remember, like the name implies, they supplement what you're doing. They don't replace, the lifestyle measures. They don't replace the medications that you're taking. They are additional kind of compounds into the mixture. So, be fully transparent with your physician, your pharmacist, your lifestyle RX doctor about them. And then the other thing I always like to do is just, try to see if you can see the effect of them. And so, we tend to use kind of lab results or measurements kind of before and after to see did that make a difference or not. So, it's probably worth trying it from that perspective.
Okay, and then what's the case study for this week?
So we're continuing to run through the different subtypes of type 2 diabetes. And so this one this week is around severe insulin resistance. And it's a really interesting pattern that we see. And it often doesn't get recognized because people with severe insulin resistance don't get abnormal blood sugars for quite some time. So let's go watch the case.
Sounds good.
Hi, I'm Dr. Brendan Byrne, Medical Director for Lifestyle RX, and I've got another case study for you. So today we're going to talk about severe insulin resistance type 2 diabetes. So this case study, DN, is a 56-year-old man presented with a new diagnosis of type 2 diabetes, but he had been pre-diabetic for a couple of years. At presentation, his hemoglobin A1C was pretty well controlled at 7.0, and his BMI was 36.9. He wasn't taking any medications, and DN's goal was to reverse type 2 diabetes. So remember, we like to think about diabetes, all diabetes in fact, as this balance between the amount of insulin the pancreas can produce versus the resistance that insulin faces in the body. That balance will determine what the blood sugar control is. Put another way, the pancreatic beta capacity to make insulin versus insulin resistance will determine your hemoglobin A1C or your blood sugar control. Now, in DN's case, what we see is that he was very highly insulin resistant, 4.95 times normal. So think about that for a moment. What that means is he requires almost 5 times as much insulin as normal in order to maintain and control his blood sugars. Now, his pancreas is certainly trying. His pancreas function is elevated at 142.3% of normal, but that's not enough to control his blood sugars. And so his blood sugars have now tipped into full-blown type 2 diabetes with that hemoglobin A1C of 7. Remember, insulin resistance is driven by fat in the liver. And with type 2 diabetes, we know that it's about 400 grams of fat, or just roughly a pound of fat, that drives insulin resistance. And that generally speaking, in order to get rid of that pound of fat in the liver, it takes about a 15 pound or 15% weight loss to do so. Now, this subtype of type 2 diabetes we call severe insulin resistance. So it's marked by the severe insulin resistance. So you see very, very high insulin resistance numbers. You also see very high pancreatic beta compensation, at least for a while. It takes longer for these patients to develop full-blown type 2 diabetes. And sometimes I joke with patients and say, you've got a super pancreas, a pancreas that can produce a lot of insulin to keep sugars normal for a long time. But gradually insulin resistance overwhelms the pancreas, even in these patients. This subtype is very responsive to weight loss, but it's hard to get weight loss started for a lot of patients. So let's take a step back and what it means to have high insulin levels like this. So remember, when you get this high insulin resistance, in order to overcome the insulin resistance, your pancreas releases more insulin. And we like to joke in our program that insulin's a bit like Miracle-Gro for fat. In fact, insulin is your body's storage signal. So when insulin levels are very, very high, you store fat, you store carbohydrates, and you actually store protein for that matter. But it's the fat that's causing the problem here. And so fat in the liver is actually causing the insulin resistance, which is what's driving these high insulin levels. So you get into this vicious cycle where essentially insulin is leading to fat, and then the fat itself is actually leading to more insulin. So you get into this loop where you really have too much insulin, and essentially weight gain becomes a real problem. Severe insulin resistance type 2 diabetes accounts for about 15% of type 2 diabetics overall. So DN enrolled in our program and learned the 4+2 diabetes reversal strategy. He did the 12-week program to take control of his diabetes to find that path. And so going through the core behaviors in each week, DN's goal was to achieve remission of type 2 diabetes. He began with a BMI of 36.9 and at the end of the program had a BMI of 33.1. So a pretty significant reduction in fat, about 10.3%. But look at his A1C, 7.0 down to 5.7. So with these patients who have severe insulin resistance, if you can lose enough fat, the pancreas is really good at compensating and getting normal blood sugars. This doesn't mean that DN's insulin resistance is gone, but his blood sugars are now back into the normal range. Again, a reminder, DN was not on any medications. So DN has achieved remission of type 2 diabetes. Now, of course, he's got to maintain that for some time for it to be durable, but he's well on his way, and with further weight loss will further reduce the insulin resistance. In conclusion, with severe insulin-resistant type 2 diabetes, weight loss reverses insulin resistance, but it can be hard to get started. Many of these patients may require a GLP-1 agonist like semaglutide, brand name Ozempic. But I really want to stress this. That should really only be added after lifestyle changes have been made. Because you can see in DN's example, he's well on his way to significant weight loss. He's reversed his type 2 diabetes, at least from a blood sugar perspective, and the insulin resistance is going away.
All right, awesome. So that's the case study for this week. All right, and then so this whole episode was put together based on your questions. We had a lot of questions about supplements. So if you have more questions you want us to answer, we always answer at least one, and sometimes we do whole episodes like this just about your questions. So leave your questions for us in the comments, either on the community post, on YouTube, on Facebook, wherever you're watching. Send us your questions, and we'll try and answer as many of them as we can. And if you have any ideas for things you'd want to see on the show as well, leave those there as well. So I guess we'll wrap up then. Do you have a thought of the week for this week?
I don't have a thought of the week this week. I had one last comment. I actually put a little blog post together with all this content that will be released in conjunction with this, because there's a lot of information here. So I've summarized it in one of the blog posts so you can kind of get that information.
Awesome. Yeah, so you'll be able to find that on the community under the Better Blog section, I believe is where it should be. All right. So thank you so much for listening. As always, we appreciate you sharing the show with anybody that you think might benefit from it. So send them the link, let them know about it, have them watch it. And if you'd like to join the Lifestyle RX program, it's currently provincially covered and available in BC, Alberta, and Ontario. And you can sign up for that using the links in the description or by just going to lifestyrx.io or just Googling us. So thank you again for joining us this week, Brendan. And thank you all for listening, and we'll talk to you next week.
Thanks, Dan.